dokie. All right. Well, thank you everyone for joining us today. We are having an event about bouncing forward, what to know about your new postpartum body. So at Origin, we really believe the philosophy of we don't bounce back here, we bounce forward. And there's a lot to learn and love about your new body. And we're so excited to be working with Fit for Mom in Austin. We work with them here in Texas. We also worked with them across California, and they are just such an incredible resource for new and expecting moms. So really excited to be able to partner with them. As a quick reminder, we are recording this session. So we'll share it out with all the attendees and anyone who registered afterwards. So if you have to drop off, don't worry about it. We'll share all the good information later. And I know we got a couple of questions in advance from people who registered, so we'll make sure to try to touch on those in the presentation. But if you have any questions at any point, feel free to drop those into the Q&A or the chat box, and we will make sure to get those covered. And I will just introduce myself. I'm Allison. I lead the marketing team here at Origin. We do virtual physical therapy with a focus on the pelvic floor, but really we take a whole body approach. We're big believers that this type of care should be accessible to everyone. And so it's really important to us that we are in network with most major commercial insurers. So really just trying to give women the care and support they need. I know a lot of people on this call are new or expecting moms. And so it's the least we can do is provide some support there. And so with that, I will introduce one of our expert physical therapists and let her take away and share all this information because she knows a lot more about your body than I do. But we have Dr. Ashley Rawlins on the call, who's a physical therapist with Origin. She is based out of Dallas and works with women from really a full body perspective, but specializes in pelvic floor, pelvic pain, sexual dysfunction, pregnancy, postpartum recovery, which I know a lot of you guys are excited to learn about, and just so much more. And she really leads our virtual physical therapy team here in Texas. So with that, I will turn it over to Ashley.
Hello, how is everybody doing tonight? I'm excited to talk to you guys tonight about your body, the pelvic floor, how that factors into exercise in pregnancy and postpartum. We did get a couple of questions beforehand, and I hopefully we'll touch on most of them in the presentation, but I will go back through and kind of make sure we are touching on everything. And if you have any questions, please feel free to add them to the Q&A or the chat, and we'll touch on them too. So, yeah, so today I want to talk about the pelvic floor, kind of just a brief pelvic floor 101. What is it? What are the functions of it? We'll touch on your body in pregnancy and postpartum, how to exercise safely in the postpartum, pelvic floor, pelvic as in pelvic floor muscle and abdominal considerations, and when to work with a PT, when things, when can you do things on your own, when can you do things with a physical therapist. So, there's so many benefits of exercise, I'm sure all of which, most of which you understand on your own. It helps with strengthening, it helps with your energy, it helps with, healing and being able to do the activities and things that you want to accomplish. But it's also really, really important for helping to help with your emotions and your mental health.
Yeah, this statistic always blows my mind. Like, I just feel like we should put this on a billboard somewhere.
Absolutely. Being able to exercise with the guidance of physical therapy can reduce your risk of postpartum depression by 50%. So it's not just important to kind of help with returning to a normal or a healthy weight postpartum, which is important, or minimizing your pain, also important, but it significantly can reduce your risk of postpartum depression. Having a little pixelation issues.
Oops,
There we go. No, it's okay. So what is my pelvic floor? We all kind of hear it, especially in pregnancy and postpartum. You hear your pelvic floor this, your pelvic floor that. But what is that actually? Where is it? What does that mean? Your pelvic floor is a group of muscles and connective tissue that make up the floor of your pelvis. So they literally make the base, the floor of your pelvis. You kind of think of like a hammock that goes from your pubic bone to your tailbone. It sits between your two sit bones and it holds up your pelvic organs. So many functions of this muscle. It helps to support those organs. Like I said, it kind of holds them up against gravity, puts them in a good anatomical position for optimal function. It helps to maintain continence. So the pelvic floor muscles themselves can squeeze around the pelvic openings, the urethra, the anus, and the vagina, with the urethra and the anus closure preventing incontinence. It helps to stabilize the pelvis. So a very important part of our body. It's literally the center of our body that needs stability so that we can do everything that we need to do, sit, move, all of the things. And these pelvic floor muscles, in conjunction with some of your other deep core muscles, but these pelvic floor muscles really help to stabilize your pelvis. They also, of course, are important in sexual function for erection, for pleasure and orgasm. They often contribute to pelvic pain and pain with intercourse. And then as a really important muscle group, they help to pump blood, lymph, they help with circulation to kind of help everything keep moving and flowing. So your body in pregnancy and postpartum. So many changes that occur. Over these 9 months, our body adjusts slowly through so much to accommodate for growing this baby. As the baby grows more forward, though, it changes our standing posture. It changes our center of gravity. The abdomen grows forward, and so we kind of tend to tip forward, or that's where our center of gravity goes. So to compensate for that, we tend to lean backwards so that we're not, falling. It's gradual, and it's not something you realize you're adjusting for, but our body makes these adjustments. So we lean back. That will increase the arch in our low back to help compensate, which, oftentimes can contribute to why we're having that low back pain in pregnancy, especially as we progress through our trimesters. Our pelvis also tips forward with that adjustment. So as we're kind of leaning back to prevent the imbalance in our weight, our hips will tip forward. This adjustment in our orthopedic structure tends to contribute to tightening of the muscles. So the hip flexors get tighter, the low back extensors, even the upper back and shoulder musculature. And it makes it more difficult with these compensation postures. It makes it more difficult for our abdominals and our glutes, even our pelvic floor to engage properly. And if we're really kind of stretched and elongated in our third trimester, that muscle just doesn't have that same functionality that it used to. Those abdominal muscles also pull apart. As the connective tissue stretches to make room for the growing baby, we develop what is called a diastasis rectus abdominis. And likely everyone has heard of this, and exactly what it is, we'll go into a little bit more. But this is normal. This occurs in 100% of pregnancies. And it's our body's way of making room for the growth that can occur.
Is it working? Are you seeing it come through?
Nope. There we go.
Okay. There's a lag.
That's okay. I know. Yeah. Good. Let's roll with it. So our body changes, and then we have a baby, and suddenly we're postpartum, and there's so much that now, there could be injury, there could be underuse or weakening of muscles and pain that is developed in joints and things like that. In the first 6 weeks postpartum, it's normal to experience some amount of leakage of urine and feeling of heaviness. This is normal and typically should improve spontaneously on its own as a result of, there's overstretching, bruising, trauma to those nerves and connective tissue and muscles. And over those first 6 weeks, things should start to proceed down a normal healing path and return back to normal. And those leakage symptoms that you are experiencing should resolve as well. At this time, so in these first 6 weeks, it's okay to start doing gentle pelvic floor muscle contractions. Typically, we tie them with our breath. That's a very normal physiologic movement. So when we breathe in, our pelvic floor relaxes. When we breathe out, it contracts. So we typically encourage pelvic floor contraction with breath. and then relaxing, just gentle contractions and movement of those muscles. That helps with blood flow. It helps with decreasing swelling and really encouraging proper healing. Of course, if it's painful, stop. But typically these gentle muscle contractions, you're doing them anyways for, bowel and bladder function. They're pretty safe to do as long as there's no pain.
And how do you know if you're like overdoing it, Ashley? Or like, how do you know when to stop?
Well, definitely pain for sure is one of those first signs. If there's any pain that develops, stop, rest. If bleeding, of course, increases, and I'll talk a little bit more about that as we do progress into exercise. But if bleeding increases, or any sort of change in what you're feeling would be a sign to stop, indicating you're overdoing it, you've done something too soon, that type of thing. Gentle movement is always encouraged. Again, that helps with circulation and reducing swelling and just getting those muscles pumping and working. And kind of, when our muscles are injured, everything kind of gets scared and stuck and doesn't really want to move. And so kind of gentle, normal movement can be really healthy in getting those muscles awake again. After 6 weeks, you do need your OB or your midwife or your obstetric healthcare professional to clear you and make sure that you're medically ready before you can have any sort of vaginal penetration. So intravaginal pelvic examinations, of course, if it's medically indicated, they'll proceed with that, but tampon insertion, intercourse, of course. You may have a little bit of continued symptoms of leakage at this point, pain and heaviness. It's really not normal anymore, though. You really should expect the healing to occur in those first 6 weeks, and beyond that, really should be reducing and going away at that point. That would be more of a sign that maybe the healing has been disrupted. There's further injury that needs to be looked at and treated. Of course, if you had a birth by cesarean section, you can begin gentle scar massage at that point, at that 6 week mark, as long as it's fully healed. There's always something that can delay wound healing. And typically at that 6 week mark, when you do check in with your OB, they will examine the scar at the abdomen or in the perineum at the vaginal opening. Oftentimes there's tearing there, so they'll check those scars. And scar tissue massage can be really helpful in softening and easing some of the symptoms that come along with scar tissue. And at that point, you've been medically cleared, and it's encouraged to start doing more activity, strengthening exercises, more aerobic types of things. There are smart trainers and vaginal weights that are often recommended to help with pelvic floor muscle function. The top two devices are these smart trainers. They typically will connect via Bluetooth to your phone device to help run you through pelvic floor muscle exercises, and they're really fun and motivating. Also, vaginal weights like dumbbells for the pelvic floor muscles, they help to encourage more strengthening. After 8 weeks, we'll kind of dig more into checking for an abdominal muscle separation. We talked about the diastasis in a couple slides ago. With that muscle separation that occurs in pregnancy, over those first 8 weeks should start to reduce and go back to normal. That healing will take a little bit longer, but around 8 weeks, we start to examine a little bit closer and see if there is any more healing that we can assist with as a physical therapist. It should still be naturally closing at this point.
And actually, like, how would you know or like check that you had, like, what's a natural closure? I have so many friends that are always asking me, they're like, do I have diastasis rectus abdominis?
Yeah.
How do I know? And I'm like, I don't know. I'm not sure.
That's a good question. So diastasis rectus abdominis, that's the separation of your six-pack muscle. So that six-pack muscle is called the rectus abdominis. And in between those two muscle bellies is what is called the linea alba. It's this thick connective tissue that kind of helps, attach our muscles together in our abdomen. It helps with creating tension when those muscles will pull and create tension across that connective tissue, very strong. But in pregnancy, it starts to thin out and stretch. That tissue can have an injury, and those muscles will become more separated. So it can occur anywhere from the bottom of your sternum to the pubic bone. It's most common at the belly button, maybe maybe a little above, maybe a little below, but that linea alba becomes thin and stretched and widened. And so, there's a couple, you may not know that there's anything wrong. Sometimes you'll start developing maybe back pain or urinary incontinence, and it may be associated with that abdominal muscle separation. Maybe it isn't, but those might be some symptoms that you're looking for. You also will see, oftentimes you can actually see the separation when you're looking at your six pack. There's a bit of a deformity that you don't remember being there before. Also, if you're like doing crunches or any kind of like pressure exercises, you will often see like a doming or a ballooning at that point of vulnerability. And those are kind of what we call signs that would indicate that maybe you want to get it further assessed. We check for how far those muscle bellies are separated apart and how thin or how able that tissue is able to create tension in those muscles, and kind of put together an idea of how much you're being affected by that diastasis. Does that make sense, Allison?
Totally. Yeah, that's awesome.
So returning to exercise, it's the big question always. At 6 weeks, your doctor says, all right, you can do whatever. Back to everything is normal again. And this includes exercise, which that can be very daunting, I think. If you don't exactly know where to start, maybe you had some injury in pregnancy and you don't want to flare things. Things are kind of calm. You don't want to flare them up again, or you don't want to develop pelvic floor symptoms, things like that. We always recommend, of course, respect your body and the changes that it has gone through, because what you have just accomplished is tremendous. Your body has gone through so much change and deserves some time to rest and heal. But you want to start slowly and ease back into exercises to avoid injury. This doesn't mean that you can't do the fitness activities that you love. You just may need to modify certain movements as you return. So in the next slide, I think we talk a bit about more what that timeline looks like. And just as kind of like a spoiler, there is no real timeline. Everybody is different. Everybody has unique situations. Everybody has, had injury or certain obstetric diagnoses. So this is like the general rule for everyone that we kind of start with, and then individualize it from there. So we start with the delivery. You deliver. I kind of mentioned it at the beginning. Obviously, proper rest and recovery is the most important thing for getting back to exercise after childbirth. If you don't allow for recovery and healing, then multiple injuries can develop from that, and other symptoms will occur that might slow down the actual progression of exercise if we're not allowing for proper healing and rest and recovery. Like I said, it's okay to begin with those gentle abdominal and pelvic floor muscle contractions. I call those like muscle sets, where you're just gently kind of squeezing the muscles and letting them go. Nothing gripping and super strong, just kind of turning them on, turning them off. Especially, post-cesarean, those muscles are injured. It's okay to just start engaging those muscles a bit and letting them go. This really helps with blood flow, helps to reduce swelling, which will really help with healing. At 6 weeks, again, if you've healed properly, then typically you're cleared medically at this point to exercise. And we do want to see that you have been medically cleared to really start exercising first. Return to exercise should be gradual, lower impact, and then start progressing from there. So it's not typically recommended to go run for your first activity. That's a very high impact activity. It can produce a lot of strain through your body and lead to injury if you're not ready for it yet. Also, breastfeeding is tricky with return to exercise. There's so much to consider. It's like, when do I exercise? Do I pump? Do I feed? How do I run or exercise with all of this weight? There's so many considerations as part of that it shouldn't be a barrier to exercise. 6 to 12 weeks. So we're kind of moving out. You're at 6 weeks. It's time to heal. And in those next 6 weeks of progression through exercises, Generally, we say, you're returning gradually to higher impact activities. Maybe we started with walking and then you're walking faster and faster and faster. Your goal is to progress towards running, but it's not what you start with. You do want to focus initially on strengthening more of those deep stabilizing muscles. So like the deep abdominal muscles, the pelvic floor, the ones that are really going to help with stability through your joints that have been super loosey-goosey these past 9 months, and helping to prevent pain and further injury. So that's a great place to start. And it's low impact. And then consider also targeting other muscle groups that are highly impacted in pregnancy, other than the pelvic floor and the abdomen, like your glutes, your upper back, your lower legs. Those can all be affected by the postural changes that occur in pregnancy and in postpartum with the breastfeeding and the closure of the back muscles. And then maybe at 3 to 6 months, it's time to return to run. If you've been working on some of the stabilizing and you're not having any symptoms pop up, which I'll talk about what I mean. And again, please pop in if there's any questions to what I've gone through at this point. So things to consider. What will impact that timeline is many things. So I kind of wanted to draw attention to events in childbirth. Maybe there was a trauma in childbirth, significant tearing of the pelvic floor muscles. Maybe you had a cesarean section. That might slow down your timeline and impact how you are able to attack returning to exercise. Any obstetric diagnoses, so things like gestational diabetes or hypertension, you're wanting, those don't always magically disappear after pregnancy, and you're wanting to kind of monitor medically how those things are affecting you in the postpartum before returning to exercise, and will affect that timeline. Are you still bleeding? Or have you stopped and then you started doing some exercise and bleeding returns? That might be a sign that you're doing too much, or your body's just not ready, and you need to kind of slow down and take more time to rest and recover. What was your prior fitness in pregnancy? What was it before pregnancy? What was it during pregnancy? That will help you, and if you're working with a physical therapist, determine what is a good place to start when you do return. Do you have any pelvic floor symptoms? I'll go over a bit more what those pelvic symptoms are, but kind of briefly, any leakage or pressure or pain in the pelvic area. If you're having those symptoms and they're exacerbated by exercise, or even they're there without exercise, those are considerations that maybe you need to slow down and seek out professional help. Of course, pain is a sign that you're not ready or that you've done too much. And like I mentioned, the breastfeeding considerations, maybe pump before you feed, or pump before you exercise, or feed before you exercise. 2 sports bras can be tremendously helpful in reducing some of that pain and discomfort that comes along with exercising and when your milk comes in. And a question I get all the time is, will it affect my milk supply? But it won't. It will not affect your milk supply. There is so much wonderful evidence to show that moderate exercise does not affect your milk supply. But it's always a energy and demand type of balance. So if you're doing too much and not eating or drinking enough water, that may affect the supply, not the exercise in itself. So I always recommend to see a lactation consultant if you are experiencing any issues with milk supply, because they can help you kind of target what it might be that contributes. So with all of that said, when to see a physical therapist? Honestly, I feel like everybody in their postpartum needs to see a physical therapist, because there's so much that can occur that we don't know is not a normal part of healing, and that we can help with before injury does occur. But for certain, you'll know you have pelvic floor muscle dysfunction if you're experiencing any of these symptoms. The pelvic heaviness or actual bulging of the vaginal tissue, that might indicate a pelvic organ prolapse. So that's when the bladder or the cervix or the rectum bulge into the vaginal vault. If you're experiencing any leakage of urine or even leakage of feces or poop, that would indicate that there might be something going on with the pelvic floor. Feeling like you have to pee frequently or urgently, like you can't make it there on time. That might be the muscles or the nerves or the connective tissue in there that there was injury and they're not doing their job efficiently like they were before. Of course, painful sex would indicate that maybe your pelvic floor muscles are injured, and pelvic pain anywhere else, pubic symphysis pain, low back pain, tailbone pain, hip pain, low abdominals, any type of pain in the pelvic area. And common causes, of course, of these dysfunctions is childbirth, but it's not just childbirth that might indicate you have pelvic floor symptoms. So if you're on here because you are pregnant or postpartum and you have a girlfriend who hasn't had a baby yet, but she's experiencing some of these symptoms, there's so many other causes of pelvic floor dysfunction, including trauma, chronic constipation, straining and not being able to empty out the bowels, hormonal changes like during puberty or menopause, or even potentially with birth control. Stress can really impact that pelvic floor. Illness, especially those with respiratory symptoms like coughing, COVID, COPD, things like that can really impact the integrity of the pelvic floor connective tissues. Overtraining, especially high impact activities like running or CrossFit, can contribute. Injury to the surrounding joints, like a hard fall on your tailbone, or abdominal surgery for endometriosis, abdominal adhesions, things like that. Even a cesarean section can contribute. You're not out of the woods if you had a cesarean section. I know a lot of times people think that I had a C-section, so I don't have to worry about my pelvic floor, but it is very common to have pelvic floor symptoms after cesarean as well. And then, of course, smoking and obesity can contribute to pelvic floor dysfunction. And as you can see, I mean, all the things that we talk about, there is no such thing as too much information for us as a pelvic floor physical therapist. It's all very relevant. I think a lot of times we're worried about talking about these symptoms. We don't want to like admit them out loud, or we're worried that maybe we're the only one experiencing these symptoms. But, you know, as a pelvic physical therapist and all of us at Origin, we know that these are all really relevant symptoms to your quality of life and health and wellness and future. And there is no such thing as too much information. We are here to help.
Yeah, Ashley, we had a lot of questions, and feel free to obviously jump into the chat or Q&A, but we had a lot of questions around incontinence and just sort of like how to prevent it, how to treat it. Is there any sort of advice or comments you can give there?
So, you know, everyone's cause of urinary incontinence is so individual. So it's hard to say specifically, and, you know, not that I could say specifically exactly what is going on with someone, but there's, you know, a lot of times in the postpartum period when we develop urinary incontinence, it's because there was injury to the pelvic floor structures that maybe make them less functional. So maybe that is that we overstretch the muscles and there is weakness, or maybe that the nerves that help the muscles to function were traumatized, or maybe it was pelvic organ prolapse that occurred, and now the bladder is sitting differently and it's not functioning properly. So it always, you know, in all three of those causes, there could be a different mode of treatment. A lot of times, if there's weakness in the muscles, we use strengthening. So Kegels to help strengthen the pelvic floor muscles. We work on strengthening of the abdomen, the hip muscles, the low back muscles to help with stabilization and strengthening of that whole pelvic girdle complex. But sometimes if there's nerve injury or trauma to that area that's causing it, there's a muscle tension that is present that is preventing that muscle from being able to contract in a strengthening way. So in those instances, oftentimes we'll need to release the tension in the muscle, teach that muscle to learn to release and lengthen again and restore some of that strength ability. You know, if there's pelvic organ prolapse, sometimes we need to strengthen those muscles to try and help with support of those pelvic organs. So it really just depends. There is, for as many different causes, there's as many different ways to help treat it. But but it is never normal, right? After that 6 weeks of healing, if you're still experiencing that leakage, even if it's just a drop here and there, and maybe it doesn't bother you that much, there is something that can be done.
Awesome.
Yeah.
What about around like perineal and rectal tearing? I know like I've had so many friends who are like, I had a grade 1, grade 2, grade 3 tear. Like, how do you think about healing those things that happen during delivery?
So important to address. Those perineal tears are not often enough addressed, I think. It depends on the grade of tearing and the significance and the involvement. For the most part, though, they should all be addressed. The scar tissue, so in a minor, at the most minor, you'll be tearing to what's called a first degree, which will just kind of affect that skin layer. And typically you're not needing stitches with that, but scar tissue can develop, right? Scar tissue is what our body uses to heal an injury. And when we have a cut, our body will lay down scar tissue. And if there's any sort of disruption in that wound healing process, then there can be, scar tissue that kind of overdevelops and causes stickiness in the tissue, the way it kind of slides and moves normally. It can affect our nerves. It can create what are called adhesions, which is when the layers of the tissue can kind of stick together. But as the injury kind of progresses back towards the anus, so we have first, second, third, and fourth degrees. Fourth being you will tear all the way through the anal sphincter musculature, and which is extremely important in bowel function and continence. So it depends on the degree of the tear, but we always want to for sure work on scar tissue to help remodel it, help it heal better in a way that is softer, more physiologic in feel and function. And then if those muscles were involved, which anything beyond the first degree tear involves the musculature of the pelvic floor, then we often want to try and rehabilitate those muscles when they're torn apart. That muscle is injured and doesn't always know how to function again. I mean, if we had if you think about having like an Achilles tendon tear or a tear at some other major muscle in your body, and the thought of not addressing it and teaching it how to contract properly again, how to be strong and return back to function, it's kind of like unheard of. Like you would for sure rehabilitate Achilles tear. I feel it's the same importance in your pelvic floor, because left untreated, it can lead to fecal incontinence, urinary incontinence, pelvic pain, contribute to pelvic organ prolapse if that muscle system is disrupted. Totally. So it's always very important.
Yeah, and I know we have a lot of obviously a lot of women who are going to the Fit for Mom classes. So we had a couple of questions about exercise, and so one was just, how do I make climbing stairs easier? 8 weeks postpartum after a C-section, like how do you think about making that a little bit more pleasant, hopefully?
Sure, I know. Well, and why is it unpleasant? Like, is there pain? Is your pubic bone hurting? Is your tailbone causing pain? Are your glutes spasming and it hurts? Or do you feel like there's a weakness in those? I just don't have the strength, to get up those stairs, or the endurance, because I'm also carrying groceries in the carrier, and I've just had a cesarean or whatever it may be. I mean, there's so many reasons. If there is a pain issue, we always want to look and make sure that those joints are stable. So, if I was examining someone with pelvic pain, I'd want to make sure that the stability of the pubic symphysis or the sacroiliac joint is there, that these muscles that are supporting those joints are functioning and stabilizing and not allowing this excessive movement. We may go over body mechanics, kind of look at how you're doing the stairs. Is there something that you're doing that's wonky? Maybe it was working for you before. Is there something we can tweak now? And sometimes it's that, there's been deconditioning that occurs in pregnancy because, like I said, when we have those postural changes that occur, we aren't efficiently using those muscles. So maybe we weren't using our glutes as much, or maybe we weren't using you had a diagnosis in pregnancy that made it so you couldn't exercise. And so there's been some deconditioning that occurred. Then we would look at more specifically what those muscle groups are that are having some weakness, and target them with strengthening exercises. And break it down so that you don't just start climbing a mountain, you start with a smaller hill.
Yeah. And then I guess just the last one, I think I know, like when I talk to my friends who are new moms, sort of the idea of getting back into exercise can just be so intimidating for so many women.
Yeah.
And so we had a question around, like, if you haven't exercised in over a year, like what's the best way to get back into movement? And I know you touched on this a little bit, but maybe you can just,
sure. Well, and that's what I think is so wonderful about groups like Fit for Mom. I think that is such a wonderful way to get back into exercise in a way that maybe not even as much about the exercise as much as it is about building relationships and finding a place where you fit in, and feeling like you're going through the same things that everyone is also going through. It's just because it's tough. As you know, early on, of course, you're wanting to start with more progressive exercises, but depending on where you left off in pregnancy is how you're going to guide yourself and what you're feeling and symptoms from that. If you haven't exercised in a year and you're wanting to return, I always kind of think, well, what is it that you're wanting to return to? And then how can we scale it down so that we can start somewhere and progress for you? And like I said, I really think that joining group classes surrounded by other moms is one of the best ways to motivate you and to support you, because it is what we find. The research shows us that one of the most important things in returning to exercise in the postpartum is that you have support, that you have someone helping you. You can't always have your children with you, or you need someone to watch them, but you also need that emotional support, knowing that what you're going through, others are going through, and everyone's there to help. So
cool.
Yeah.
Well, I think that's all for questions. But this was so wonderful, Ashley. Thank you so much. And thanks for all of the moms for joining us. Hopefully.
Thank you. It was fun. And hopefully everyone had their questions answered.